Health leaders are seeing similar patterns between the 1918 influenza pandemic and what's happening right now with COVID-19.
Two infectious disease experts right here in Kansas City have done extensive research on both these pandemics. Let's bring in 41 Action News reporter Dan Cohen, joining us live this morning from Research Medical Center. He talked to both of these experts. Dan, they've found some really interesting trends between the pair.
Yes, they did, Taylor, and these two infectious disease physicians are also brothers here at Research Medical Center, Dr. David and Joel McKenzie. They've been working together here at Research, looking at the two pandemics from 1918 and 2020, and they've narrowed that focus into how Kansas City responded to both of those pandemics. They're seeing a lot of patterns emerge in terms of the response. They say Kansas City back in 1918 watched influenza ravage the East Coast, particularly in Boston and Philadelphia, and while that reaction has been a little bit different during the coronavirus pandemic as it has spread across the country, they're seeing similar patterns as to how Kansas City is reacting to the coronavirus pandemic here in town.
In retrospect, many of the social distancing efforts that were undertaken back in 1918 were highly effective. So we know that social distancing works and it saves lives. And we also learned in 1918 that consistent messaging and getting everyone on the same page with regard to how to socially distance and how to best protect ourselves is highly effective.
Sounds pretty familiar, right? They say that consistent messaging for masking and social distancing, they say that it's dispiriting when they run up against people who are against those measures, but they say it's a community-wide effort. It worked back in 1918 to slow that pandemic down, and they say that everyone needs to do their part to do the same here in 2020. Taylor and Lindsay?
Well, Dan, we know this isn't over by a long shot. What are the McKenzies and their colleagues at Research really confronting right now?
When I spoke to the brothers, they say that it's a challenging time for them right now. They're treating these patients and they're doing their best to fight the virus, and it's dispiriting and emotionally taxing for them when they're trying their best to treat these patients, sometimes unsuccessfully. They say that this is not over yet. They are working harder than they ever have before here at Research, and their fellow infectious disease colleagues are working around the clock as well to try and slow this down both here in Kansas City and across the country.
Dan, thank you very much.